is subclavian. Okay, you have a branch that's going upwards right here, and this one, the external jugular, in between there, that's a subclavian. Then when we get past it into the armpit region, it's axillary, and then when you follow the same one into the arm, it's brachial, right?
Okay.
So vena cava, superior vena cava, brachiocephalic, internal and external jugulars, subclavian, axillary, brachial.
Okay.
All right?
Where's the pulmonary trunk? Is that little?
Yeah, I think she pointed to it right here.
So it's not that little.
So it's not the white little cap.
No, this is just
It's this thing right here.
exactly.
Okay.
What is that? A fatty heart?
It's a little fat here on top of the aorta. Yeah.
High cholesterol or something like that?
It's from high cholesterol. Right? What's the one next to it?
It's going into the stomach, right?
Gastric?
Gastric.
No, we're going next to the celiac artery. So look, these two are both reaching up.
Is that the splenic?
No,
Celiac.
Gastric?
It's
no.
not the gastric. It's
Keep going.
Oh my God.
Just keep going down the list. You'll get it.
splenic.
It's superior.
Oh, superior mesenteric?
Yes, and then here's inferior mesenteric.
Where's the inferior?
Okay, this
So-
one's
All right. So this is
Superior
the abdominal
Mm-hmm.
aorta, celiac artery,
Inferior mesenteric.
inferior,
Nope,
superior
superior.
mesentery,
Mm-hmm.
inferior mesentery.
Right.
Arteries.
Right.
Okay.
Okay. So what are the branches off your celiac trunk? You should just tell me what they are, just in order. Hepatic, gastric, and splenic, right?
So we have the hepatic.
So we need to find the one that's going to the liver. That's this one.
So that's the hepatic.
That's hepatic. Gastrics, whatever ones are touching your stomach, that's these guys.
Okay.
And splenic, the one going up into the spleen, right?
Okay.
Right there.
Okay.
Hepatic, gastric, splenic.
Splenic. Cephalic.
So abdominal aorta, celiac, hepatic,
Mhm.
gastric, and then the splenic is this really
Right.
long one. And then this is the superior mesenteric artery, inferior mesenteric artery.
There you go. Yep.
Okay. Renal vein, and then the renal artery.
So now we're going to the gonadals.
So then the next thing we need is the
The spermatic.
spermatic artery or vein. Okay.
It's gonna be these tiny little guys here. This one,
That we cut.
the vein got cut, but the artery is right here in my hand. So
Okay.
these are the artery veins. So if it's a male cat, then it's spermatic.
Spermatic.
If it's female, they're going this way to the ovary, and they're called ovarian.
Ovarian.
Okay.
Okay.
And then can we just do the whole thing with you?
Let's do the whole bottom half.
Yeah.
So what else do we have? I'll point to it. You tell me what it is.
Okay.
Okay. What is this one again?
Inferior mesenteric
Yeah.
artery.
Tell me what that one is again?
Superior.
Celiac artery.
Celiac, and then that one is.
The superior
So-
mesenteric.
Yeah.
Exactly. Okay. Keep going over those. All right. So we're past. Let's see. What are these guys? Lumbar spine region.
Iliolumbar artery and vein.
Yep. Okay. So the aorta is going to branch into
The
two sets of forks. What's the top set?
The iliac.
Mm-hmm. External iliacs.
Okay.
Okay. And these guys. This set of forks. So you just said external. What are these?
Oh, internal.
Internal iliacs.
Okay.
And where's
Okay.
the external?
External on top,
Okay,
big ones. Internal, the little ones. How about the veins? What do they split into?
Internal and external iliac.
So they have the same names.
Okay.
So right when it branches, it's called common iliac. And then as we go a little further down, it's external iliac vein. And the internal iliac vein is kind of
Underneath
deep.
all of it.
Yeah, it's really deep in here. The shadow is not going to let you see it, I don't think.
Okay. But as long as we find like the external, we can.
You can tell when
The
the internal
internal will
is
be
down here
right
where my
under.
probe is now, but if I keep picking it, it's going to snap it.
Okay.
But it's way down there.
Okay.
How about the little ones going to the tail? What are they called? Caudal, exactly. And those, you can kind of sort of see right there. If I'm moving them, moving the artery and vein. They're
Okay.
kind of moving. They're way down there. Just remember, they're very deep. They're heading to the tail.
Okay.
Okay. So as we keep going, what's in the thigh?
The
Femoral.
femoral.
Mm-hmm. And as we get around, usually around like the bend of the knee, there's a branch point here. What's this one called now? Greater saphenous.
Okay.
Exactly. So that's your vessels.
Okay.
How about these little guys? You have a male cap. What are these structures called?
Spermatic cords.
These guys. Spermatic cords will lead into this. You have it here, and you have them.
Vas deferens.
Exactly, yeah, vas deferens. These little guys here on the side. So if that's vas deferens, this should be, your cord should be up under here.
And that would be the spermatic cord.
Mm-hmm. Okay, there's spermatic cord. Yeah, right there. Under here. Okay?
And the spermatic cord leads into the.
They go into the
Good.
testes, yeah. They're
Testes.
kind of, you didn't take them out. I think somebody never did. But on top of the testes, you have epididymis. Then the testes itself, just be able to identify
We did it
that.
over here. Didn't we do it over here?
Did you take one? Yeah. So you have epididymis, then the testes. And that's your
Okay.
cord here. Yep, awesome.
Okay. So the cord is just
Spermatic cord.
spermatic cord.
Cord.
Okay.
Epididymis.
Okay.
Okay?
Yes.
So that's all the vein.
Maybe that's some of it here. I don't really see much left of it though.
Okay.
It's pretty
You're
easy to
gonna
clean
ask
up.
that?
If I have a good looking one, I will. I
Is it
don't.
gonna be nice, bright and yellow?
It'll be so perfect. You'll know exactly what I'm looking for.
So that
Alright,
will
so
be.
this is the thoracic aorta,
Uh-huh.
abdominal aorta,
Right.
and then underneath the thoracic aorta would be the thoracic duct.
Right.
And what does that do?
It carries lymph. It's carrying lymph,
Okay.
right?
was right.
Cool.
Yeah. So you wanted lymph nodes? Well,
Right,
let's
we
see.
had
I would
one
like to
in-
ask it usually in the neck. I don't see any there.
Oh, there were some.
We had some in.
Yeah.
The mesentery?
Yeah.
Yeah, I think you guys did.
Yeah. Little beans.
Yeah, these
Right there.
guys.
Nasty little thing.
You had some lymph nodes in there. Yeah.
Right, did you get that lymph node?
Mm-hmm.
Here you go. Okay.
Right.
And then spleen.
Spleen.
Where?
The other side.
Good guy.
This thing.
The thymus gland.
Thymus gland. Did you guys have one or keep it?
We took it out. So
Didn't keep it.
We drew
that's
it away.
up here now, right?
Kind of lays like right here.
Okay.
Larynx.
Larynx is up here. We didn't take it out.
Mhm.
But
You
it's,
can-
it's easy to see.
See right here? Feel how hard it is? That's a larynx. It's kind of like plasticky versus the trachea. It's kind of.
Ridge. Trachea.
Lobes of the lungs. Okay. So we have the anterior lobes, the middle lobes, posterior lobes, and the mediastinal.
Mediastinal, yeah.
Mediastinal.
Which one was the posterior?
Right here. It goes anterior, middle, posterior, and then in the middle, right underneath the heart, is the mediastinal.
Okay.
Diaphragm.
Right here.
How does the diaphragm?
Okay, when you're exhaling, it moves up. When you're inhaling, it moves down. That should be really easy. Just breathe.
All right, the parotid, where the digestive system, parotid gland,
Right?
That I don't know. Where is that?
where is it?
I don't know.
Oh,
I'm asking.
So you have an apartment up there, or are you gonna room?
Would that be up here? Esophagus. This little squishy thing next to the trachea. Stomach. Stomach is right here now. Stomach.
part of the stomach. Cardia.
The cardia is, that's right here, right?
Yes, it's the beginning.
Cardia,
Yeah, the cardia is the beginning,
fundus,
and the body.
the body is the pylorus. or the body.
is the stomach, and the
And
pylorus.
this, and the pylorus, that's right here now.
The left
What?
side, yeah.
The pylorus.
And liver,
Liver. That's this thing right here.
gallbladder,
This little green thing right here. See it in there?
common duct, common bowel duct,
Oops.
I don't know what that was, but that's cool.
Common bile duct.
Common bile duct.
and then the parent.
Don't worry about carotid gland. That's up in the cheek.
Oh, okay. I was
All right.
wondering-
So did you find the gallbladder?
Yes, right here. So the
So-
common bile duct is right here.
Yeah, exactly. Run it from the gallbladder.
Bladder into the
Duodenum.
duodenum. Yeah, because this is the beginning of the duodenum. Right here. So, pancreas.
When you greater omentum,
Yes.
your lesser
This thing.
omentum.
Greater omentum. Where's the lesser? Do we kill it?
It's underneath the liver. The greater, lesser.
Oh, the lesser omentum right here. Got it?
You got the pancreas?
Yes, we got
Was it that string thing or the whole thing?
the stringy thing.
Okay.
Where's the pancreas? Pancreas is right here.
Duodenum.
Duodenum is right here. Then you have the jejunum
And the ileum.
and then the ileum.
I guess. Do you have to worry about that iliac valve?
Yes.
And
Okay.
the
So here's the jejunum, the ileocecal valve. I'm gonna clean it up for you. See it right there. Ileocecal valve. Then the ileum is right after the ileocecal valve. And you have the ascending aorta or ascending colon, transverse colon, descending colon.
And what about the mesentery?
And the mesentery is all this stuff in here.
And the cecum.
Cecum is right here. The ascending colon. And the cecum is right
Before the ascending is where the little, before the hole.
Yeah.
Yeah. Yeah, it's right, yeah, somewhere in there. If you feel it, it's like a hard little.
and the anus over there.
Show me the record.
Right in here. It's like I can't show you.
Like you didn't know.
It's like down in there.
anus.
The anus is over there, okay? If you don't know that, you're in serious trouble.
Okay, can you point again to
Ureter.
Urinary bladder.
That's this fatty little thing here. Is the urinary bladder.
No, that's the urinary bladder.
Okay.
Those up on the
Alright,
side.
let's start out. Kidney, ureter, urinary bladder,
Urethra.
urethra. Is that this thing?
Mm-hmm.
Exits the bladder.
Let me get a copy of that. Like right in there. Can you tell that that's?
Mm-hmm.
And then
That's it. Come on.
okay.
So let's finish the cat. So thyroid.
So we need to know where the thyroid is.
Thyroid. Yeah, it's on your list, right?
Yeah.
I could ask it.
Where is it?
thyroid's usually
No, the. Do it.
What are those?
Okay.
That's the adrenal gland.
Yes.
Testes. This is a male.
You should know that.
And we know where the ovaries are. Okay, so
And we did the pancreas.
we have a all the way down.